So what's happening with healthcare and emissions outside of hospitals and clinics in the big picture of the healthcare system? So right now, this is the scenario we're in Australia. Australia has committed, as Amanda mentioned, to net zero emissions by 2050. To meet this goal, Australia must reduce its emissions by 43% by 2030. In 2021 to 2022, Australia produced 422 million tonnes of coal. That results in 1.1 billion tonnes of greenhouse gas emissions in just 1 year. The resulting health bill from recent research from coal-fired power cost the health system a staggering $2.4 billion. And 3 new coal mines were just approved. An interesting paper and some, we love metaphors and analogies in this space, we really do.
Yeah.
One that came out from a paper yesterday was a coal mine. The amount of heat generated from a singular coal mine can be somewhere, that's equivalent to 1.7 million atomic bombs. The heat generated from that is the same. And so just to get a picture of what we're talking about, because when we say it in the reports, the number is quite small. The impact sounds tiny, but when you equate it, it's quite big. So I'll make another analogy.
Keep them coming. I love them.
If healthcare is a ship,
Yes.
let's make sure the ship functions efficiently, effectively, and let's make sure it's strong and sustainable in regards to the emissions it emits. And just like other epic stories about ships, let's not forget to repeat, and let's not repeat the history by developing and sustaining the best ship of all time to forget about that fossil fuel iceberg. It's big, and if we don't look out for those emissions, and if we don't take, and let's not forget the health impacts from the air pollution, that devastating effect it can have on communities, that iceberg will sink the ship, and it'll do it good.
Yeah.
And so I think it's incredibly inspiring that we are building ourselves within the system. But I think we've done this before where we have used the health argument to make sure other systems and other sectors are also behaving so we don't let them burden us even further. An example is the tobacco industry. And that fight, we've done it before, so let's learn from history. And I think my goal really, and so many of us working in the sector, our goal is to ensure that everyone knows that health is a human right. And it's important that each and every single person knows how to advocate for it inside and outside health facilities.